Hello, everyone. I hope you are all having a wonderful day. I'm Danielle Rosil, and I am very excited to be talking with you guys today about treating acne and treating acne with confidence. This is a topic that is near and dear to my heart, and I know many of you, if you personally have suffered from acne yourself, or if you haven't, you know somebody who has, and you know the difficulties that comes from acne conditions and just overall the confidence that can take a toll in somebody who is suffering from acne. So as estheticians, we are seeing more and more clients coming in that want to help to clear up their skin. So we are going to dive in deep today, all about acne. And in order to really understand and be able to confidently treat acne, I think it's important to really dive into the causes of acne, and also just painting the page and the picture of the landscape of how many people truly suffer from this condition. When you are going through it, when you're talking to your clients who have acne, it's not uncommon for them to feel like they're the only ones that are really suffering and going through it. But as you can see here, I know this is in the United States. That number was just really what jumped out, and this is a international, and every single person can suffer from acne. So in the United States itself, there's 60 million people suffering from acne, and of those 60 million, these are numbers from 2020, of those 60 million, 20% have acne bad enough that it will actually result in scarring. So when you're diving into the condition, and like I said, in order to really be able to successfully treat acne and know what's causing the acne, is to fully understand the pathology of the condition itself. Now, acne is something that it's not curable, but we can absolutely make a huge impact in reducing the symptoms, the amount of breakouts, the severity of those blemishes, and it all comes down into what is going on in the skin to actually result into whether it's a open comedone, closed comedone, papule, or pustule, and then ultimately could potentially lead into cysts or nodules. And regardless of the severity of the acne, these are the four main causes that you'll see. So you will have an increased keratinization. There is an increase in sebum production. Inflammation is oftentimes present, and you will have an increase of P. acnes bacteria. So as I'm going through the daily care treatment options, as well as the professional treatment options that you can do in the treatment room for your clients, we're going to continue to tie back the ingredients and the products to these four main causes and where they're going to help treat that acne condition or that acne lesion. So here's a great diagram to just really highlight the stages of acne and the stages that the skin will go through. So you can see here on the left-hand side, you have a normal, healthy hair follicle, sebaceous gland is functioning properly. Then when it's progressing through those stages of acne, typically it's going to result in either a open comedone or a closed comedone. So open comedone is a fancy way of saying, a blackhead. Closed comedone is more of your whiteheads. You can see here that it is more so an increase of that keratinization, but there is no inflammation that's involved within the open and closed comedone stages of acne. But you do have that plug. And what happens is as that keratinization is increasing and you have a plug on top of the skin, it creates a perfect breeding ground for bacteria. So if nothing is done to help to exfoliate and clean out that pore and that follicle and reduce the keratinization within that follicle, you have a higher chance or likelihood for it to then progress into your more inflammatory stage. And that's going to be your papule and your pustule stage. So moving down in that second row, you can see that on the surface of the skin, right here, you have more of that inflammation that's happening. But the other thing that you'll notice is that the bacteria and infection is starting to kind of bleed out into the surrounding tissue. And when that occurs, that's what's triggering more of that inflammatory response within the skin. Then you can progress over as that P. acnes bacteria starts to multiply, proliferate within the skin. You're seeing it bleed out even more, and that's where you're having the increased inflammation to that surrounding tissue here. So as it's progressing from the papule into the pustule, the other thing that may occur is if you have pickers, a lot of times they can actually rupture that follicle wall. So you'll notice in the pustule stage, that follicle wall is no longer intact the way that it is when you go up here and look at, say, the whitehead stages of acne. So that follicle wall has ruptured, and now that bacteria is bleeding into that surrounding tissue, causing more inflammation and irritation. Now, sometimes this can happen just naturally because the follicle wall becomes weak when you have too much infection or bacteria in there. It will break, but in the event or case of people who pick, they can actually go in there and rupture that wall, and that's where you get more of that spreading of the bacteria. So the bacteria can now have free reign, and it can make its way into other follicles that may not have been infected in the past and previously. Then the most severe stage of acne you will find is the nodule and cyst. So here you can just see that bacteria, that infection has taken over underneath the skin. You have a ton of inflammation. Scarring is very, very common and most likely when it reaches that nodule and cystic stage. So going into, there's actually 4 different grades of acne and 2 classifications. So within acne in general, you have your acne simplex and your acne vulgaris. So acne simplex is going to be your grades 1 and 2 acne. So grade 1, there's no inflammation present in here. All you're seeing is that open and closed comedones. Then grade 2, you will see a few papules and pustules starting to show up in combination with open and closed comedones, but it's still not an overly inflammatory stage of acne just yet. Now, when you progress into acne vulgaris, so this is going to be your higher grades of acne, grades 3 and 4. When you hit the acne vulgaris, this is where scarring is very, very likely just because of the amount of inflammation that is caused within the skin. That inflammation can trigger a lot of harm and damage within the skin. So your grade 3 acne, you're seeing more and more inflammatory and bacterial lesions. Then progressing up to the most severe type of acne, which is going to be grade 4. These are open and closed comedones. You're also going to see some deep cysts and nodular lesions. Scarring is more than likely to occur within this stage, and more often than not, when you're dealing with, or if you have a client that comes in with grade 4 acne, medical prescription intervention is oftentimes recommended. Now, with that said, that doesn't mean that they wouldn't want to be using, proper home care products in conjunction with these prescription treatments. So it's working with your client and having your client work with that medical professional dermatologist that's prescribing these medications, but ensuring that they're still cleansing their skin appropriately. They're still wearing their sunscreen to protect, but working in conjunction with. I think a lot of times as estheticians, it's important to know, where can we treat? How can we pair with our clients to ensure that they are getting those maximum results when treating skin conditions? And when is it appropriate to refer them on? We can make a huge impact in treating acne, especially when you're looking at grades 1, 2, and 3. And we still have a very, very crucial role in helping to treat acne in your grade 4, because proper home care is imperative. Now, we want to, so diving more so into controlling acne and how ClarityRx can be a valuable tool when treating your clients that are coming to see you with acne. I think the biggest thing is ensuring that we have a clean yet very effective skincare line that you're recommending. We want to, like any other skin condition, we want to make sure that we are limiting and reducing the amount of irritants that are being applied to the skin. We do not want any synthetic dyes, synthetic fragrances, and ClarityRx is a very clean plant-based line that will not cause any excess inflammation or irritation, but you will see very effective, very powerful results. So we have that pharmaceutical grade with the plant-based, and that's what we're looking for. So clarity isn't what we're called, it's who we are. We want to deliver that clear, bright, luminous skin, and we can do that. So diving into our products that, again, we want to tie it back to controlling those 4 main causes of acne. And it all starts with, it's a very simple 4-step process in controlling acne in general. So keeping in mind the causes, but the first cause of acne is an increase in keratinization. So when we're looking at controlling acne, we want to ensure that we are gently exfoliating and increasing that cell turnover. So if we do not have that plug that is initiating, creating that perfect breeding ground, the bacteria can't grow where there's oxygen present. So by increasing that keratinization or normalizing the skin's cell turnover cycle, we're not giving the skin an opportunity to be able to have that breeding ground for bacteria. So the first and most important step here when initiating the treatment of acne, whether that's grade 1 acne or grade 4 acne, is helping to control that keratinization and increasing that cell turnover. So here you'll see the cleanse and exfoliate step. The correct step as we go through each individual product, you'll notice that there is an exfoliation component to each and every one of those products. The next step within controlling it is going to be to control that sebum production. So you have an excess of oil production. So how do we control it? We don't want to stop it. We don't want to strip the skin, but we do want to control so it's not overproducing. Then we want to decrease the amount of the P. acnes bacteria and how quickly and how much it's multiplying within the skin. And then last but not least, we want to protect the skin. So acne clients are typically the hardest ones to help, getting them on a sunscreen, but a proper sunscreen is very, very important with acne, because most of the products that we're using to help to treat the acne lesions, help to control those acne breakouts, can be photosensitizing. So we don't want to cause more harm than good, and we want to ensure that they are protecting their skin. All right, so in this first stage, so this is going to be your cleanse and exfoliate step. So good to go pads, these are a wonderful option, especially for those who are more active, your adolescent clients that are suffering from some breakouts, your athletes, especially in men, if they're, playing football or soccer or anything like that. right after they're done exercising, or softball players that they're wearing a helmet, that can cause some friction, and with the excess sebum and sweat and dirt, bacteria, we want to make sure that they're cleaning their skin and keeping their skin as clean as possible as quickly as possible. Well, it's not always the most realistic thing to have your client, as soon as they're done exercising or they're outside, to go home, cleanse their face, do a 4 different step facial regimen throughout the day. So good to go pads are a wonderful option to have in a gym bag, in a backpack, in a golf bag. This is going to be your 3-in-1 facial treatment. So each of these pads, so a box comes with 20 of them. They are pre-soaked. So here it has micellar water. It's got hyaluronic acid as well as vitamin C. So when we are cleaning the skin, it is important that we are not stripping the natural barrier of the skin, because the sebum production is a crucial component in our barrier function. If we have an impaired barrier function, we actually leave our skin open to more dirt, debris, and potential for bacteria to then your skin can actually break out even more. So we want to avoid over cleansing, especially when it comes to treating acne. That tends to be a common theme of, I keep washing my face, I don't know why, I keep breaking out. It's about creating that balance. And within the Good to Go pad, because it has the vitamin C, it's going to strengthen the skin, but that hyaluronic acid is going to help to maintain that water balance within the skin. So that way you are not creating a stripping effect. So they can use this, I would say, once a day. Great for those times where you do not have a sink present. If you guys you're wearing masks on a daily basis. So being able to, do a midday pick me up with the Good to Go facial pads. These are an excellent option to have on hand. The next is Down and Dirty. So Down and Dirty is going to be our detoxifying charcoal micro exfoliant. So the Down and Dirty is a physical exfoliant. So there's 3 different types of exfoliation that we can utilize when treating acne, and it all comes down to the sensitivity of the client. So one thing to note when you are looking at more of a physical exfoliant is this would be suitable for your lower grades of acne. So your grades 1 and 2 acne. If you have a client that is suffering from more inflammation, they have quite a few of those pustules that are present, a physical exfoliation would not be the first type of exfoliation I would recommend, and we would recommend you going to. So if you think about it, they have that bacteria and that inflammation already. If you're using a physical exfoliant, you run the risk of breaking open one of those pustules or papules, and then you have the potential of spreading that bacteria to the surrounding follicles. So keep in mind with Down and Dirty, you're going to want to recommend this more towards your grades 1 and 2 acne. If it's a low grade 3 acne and there's, not a ton of papules and pustules or inflammation within the skin, then this would be appropriate. But just keep in mind how many pustules and papules that are present. So within Down and Dirty, this does have a really nice kind of menthol cooling sensation. It will help to draw out that dirt and bacteria within the follicle. So the activated charcoal that's in here, it actually has more of a magnet-like effect to it. So as they'll apply this to the face, you'll do really gentle circular motions. And as that activated charcoal, so that's what's creating the granular effect that's doing the physical exfoliation, is the activated charcoal. As it's rolling over those follicles, what it's doing is it's helping to attract that dirt and debris that's within the follicle. So one, you are removing that excess keratinization and buildup on the surface of the skin, dead skin cell buildup. Second mechanism of action is it's pulling out that dirt and debris and bacteria within the skin. So this is something that you would either use morning or night. You would use it once a day. You don't want to use it twice a day. So whatever your client prefers, it's just coming back to what's their lifestyle, when do they have more time. So either preference, that's up to you to discuss with your client, but either morning or night, you don't need a lot, wet the skin and do gentle circular motions. The key word here is going to be gentle. You don't want to put a lot of pressure. While the activated charcoal beads in there, they are smooth and round, so you don't have to worry about it creating any sort of micro tears or cuts in the skin, but you still want to be more gentle when you're using any sort of facial scrub. So light circular motions, then you'll rinse the skin with warm water. So this is gentle enough to be able to use on a daily basis. Just keep in mind once a day. The other ingredient in here, so there's green tea for powerful antioxidant protection within the skin. And then the bladderwrack is going to be a great mineral-rich seaweed that also has water binding properties to it. So this is going to help to nourish the skin, because while we want to control that bacteria, we want to exfoliate, we want to make sure that we're still very gentle and nourishing, so that way we're strengthening the skin while also treating those acne breakouts. The other product in the liquid cleanser step, and I apologize, there's not a slide for that one, but I want to make sure we make note, is the cleanse as needed. So cleanse as needed is going to be our 10% glycolic acid cleanser. Glycolic acid is going to fall in your chemical exfoliation step. And this is going to be something that they could use every single day as well to initiate and help to speed up that keratinization and exfoliation within the skin. So after you cleanse and exfoliate, the other thing that a lot of times happens is your clients want to remove any sort of surface lipids or oils. I can't tell you how many times I've heard professionals tell me that their clients are using, witch hazel, or they're using alcohol or astringent on their skin, which we know is disrupting that barrier function, causing the skin to go into more repair mode and stimulating more oil or sebum production. Fixit is a wonderful option to be able to introduce to your clients that like the feeling of more of an astringent or a toner type consistency. So they will apply Fixit in a very similar fashion. So you'll see here it's a liquid, and they will apply it with you could apply it with a cotton round, you can apply it with a cotton ball. If you put the cotton round or cotton ball directly on the neck of the bottle, you can flip it over and back, 3 to 4 times, saturating the cotton ball, but not oversaturating it, and use it on the skin like an astringent. So this product is very unique, and it really falls in line with our clean simplicity. So this has 3 ingredients in there. So you have your 2% salicylic acid, which is going to be a beta hydroxy acid. A beta hydroxy acid has a keratolytic action. So it's very unique in the sense that it's lipid loving or oil loving. So it's attracted to the oil within the skin, but it also has the capability to penetrate into that follicle to help to exfoliate out that keratinites and keratinocytes that are within that follicle wall that eventually plug that follicle. So this can go in there, it can exfoliate and work on that over-keratinization within the follicle. It's also going to help to control that oil or sebum production. So within this product, you have your 2% salicylic acid, you have denatured alcohol. And the reason why the denatured alcohol is in there is because liquid salicylic acid is very, very unstable. The molecule itself, just scientifically, is an unstable molecule. So we need this liquid form of salicylic acid not only to help to stabilize the denatured alcohol to help stabilize the liquid form of salicylic acid. It's also helping to serve as a delivery vehicle for the salicylic acid. And then you have your purified water. So this is something that your clients can use. I would start off progressively. We want to ensure that they are only using it at night. And starting off, I would do once a week. Do that for about 2 weeks, and then you could progress into twice a week. The sweet spot with this specific product is about 3 nights per week as an exfoliation. So this is a way to think about this one too, is more so a take-home chemical peel that your clients are able to do, but it's very powerful in increasing that cell turnover. But salicylic acid is derived from aspirin. So one thing to note is just make sure that your clients do not have an aspirin allergy. But with it being derived from aspirin, it has a very powerful anti-inflammatory property to it. So this is a perfect option for all grades of acne, especially more so when you're looking at the grades 2, 3, 4 that has a lot of inflammation and it has a lot of those pustules and papules that are present. Next within our correct step are pick-me-up booster pads. So these are a combination of your AHAs, your alpha hydroxy acids, and your BHA with salicylic acid. These are so each jar comes with 50 pads in there, and they're going to be single-use pads. So they will use this 1 to 2 times a week. Again, you're going to want to make sure that they're using this at night just to avoid any sort of over exfoliation within the skin. So your glycolic acid, like I was mentioning with the cleanses needed. Glycolic acid, when you're looking at your alpha hydroxy acid family, it has the smallest molecule. So it's going to penetrate the skin the quickest. So it's not uncommon to feel a little bit of like an itchy or tingling sensation when they apply this. Just let your client know up front prior to using it that this might be a sensation that they experience. These are a very convenient, easy to use. So with your Fixit, you have a cotton pad. This one, it's all pre-soaked and saturated. The other great place to use these pick-me-up pads, and very simple, if you have, so acne doesn't just happen on the face. You will see that there's, you can break out on your chest, on your shoulders, and the pick-me-up booster pads are an excellent treatment option for body acne as well as acne lesions on your face. Okay, so for those pesky breakouts that just pop up, and maybe for somebody who doesn't necessarily have acne lesions all over their face, but they have these, few key larger breakouts, ClearZit is a great option for them. I know, speaking with a dermatologist, he likes to call this product the Zit Zapper, and I thought that was perfect because it really does pack a punch, and it will zap those zits. So this one has salicylic acid, glycolic acid, as well as witch hazel in there. So this is going to be your spot treatment for those papules and pustules. You can use this morning and night. If you have somebody who, you can use this maybe midday as well to help to fight that inflammation, the bacteria, as well as increasing that cell turnover within that follicle. This is great to keep in your bag. Works well in a purse. So if you're on the go, always having this clears it there, especially for your maskne. This is a nice take-home product to be able to recommend your clients to really target those specific lesions. Now, a question has come up, as far as using this applicator wand with any sort of papule or pustule and questions on cross-contamination. And I want to make you guys comfortable. The wand itself, so the material that the wand is made out of is antimicrobial and antibacterial. The alcohol in there will also help to ward off any sort of bacteria. So it is just not physically possible for bacteria to grow or transfer in there for many reasons. So the pH, the ingredients in there, but then also the wand itself is specifically designed to be antimicrobial and antibacterial. All right, so we talked a lot about, cleaning the skin, exfoliating the skin, helping to control the sebum production within the skin, but creating that balance is also very, very important. We need to control that bacteria, the bad bacteria in the skin, that P. acnes. But we do have some good bacteria on the surface of our skin, and that good bacteria plays an important role of keeping the skin healthy and having our barrier function be in a state to where it can ward off any sort of environmental stressors or added bacteria or anything like that. And this probiotic, so the Get Balanced Probiotic Serum, is the you can use this morning and night, and this is an important part in maintaining the skin health and hydration. So when we're talking hydration, we're talking more of that water content, not necessarily that oil content within the skin. When your skin is hydrated, it almost it can have an effect of where it tricks the skin where, okay, I have enough hydration water content, I'm not going to produce oil to try to protect myself. The probiotic serum, the probiotic in there, so the lactobacillus, helps to balance out that combination of the good bacteria as well as warding off the bad bacteria in there. The sodium hyaluronate helps with the overall hydration, and it's going to balance out the microflora within the skin, creating a nice balance. Now, this is a very light consistency and texture. So whereas you might have, just depending on the client, a little bit more of a harder conversation in having them using a cream type hydrator or moisturizer, Get Balance is a perfect starting point that that the skin is going to get the needed hydration while you're still exfoliating. That's also going to treat help to treat the acne breakouts by balancing the good and bad bacteria in there. So morning and night, about a pea size. When combining with the exfoliants, so say you're using Fixit, you would cleanse the skin, use Fixit, and then you would apply your Get Balanced serum on there. So, and that would be your nighttime regimen, finish with a moisturizer. If they don't use a moisturizer, then Get Balanced will help with that hydration there. And you can gradually bridge into getting them to use a moisturizer. The other product that is great for adding that hydration, creating that overall balance within the skin of the water and lipid content is going to be our daily dose of water. So this is oftentimes a product that people will think, okay, this is great for dry skin, this is great for aging skin, but why and how does it fall into the treatment of acne? And I will repeat it over and over as far as making sure that the skin has enough water so that way we're not stripping that barrier of the skin. When we are treating acne, so if you're using, your glycolic acids, your salicylic acid, we have witch hazel in there. We want to make sure that we're also putting back a lot of the good hydration and all of the good nutrients within the skin. So daily dose of water attracts and binds water within the skin because of the hyaluronic acid in there. So this is one that they can use, your acne clients can use morning and night to make sure that you're not over drying the skin. So nice lightweight serum for hydration. Then you have, so going into your creams, Call Me in the Morning is a great moisturizer to recommend for your acne clients. It is a very light moisturizer, especially when you're looking at the more of your adult acne. As we age, we lose that, we lose some of our surface lipids, our hydration levels, just hyaluronic acid naturally depletes. So their skin needs a little bit more hydration in there. And Call Me in the Morning, because it has a lot of anti-inflammatory properties to it, it makes it a great option for your acne clients because there's an increase in inflammation within the skin. So it's going to help to soothe the skin, calm that inflammation. It has a great matte finish to it as well. So they're not necessarily going to have a really dewy, heavy feel, which will turn away some of these acne clients, especially ones who have a lot of oil within their skin. Call Me in the Morning with that nice matte finish is a great option. So using this in the morning. If you have somebody who prefers to use more of a moisturizer at night versus in the morning, there's nothing wrong with that. We just have it slotted in the morning time. But I would definitely only have your acne clients using this once a day, unless you run into the case where they are very, very dry. Then you make that call as the licensed professional and the expert in treating their skin, that if it's more appropriate for them to use it twice a day, then you can do so. But starting off once a day, you can always add frequency. It's hard to back off if need be. Next, within the treatment category and masks, so making sure that your clients not only are coming to see you on a regular basis, especially when it comes to treating acne, is important. And we recommend, twice a month, every 2 weeks to come in for treatment, but also having them use these products at home because they're touching their skin twice a day. So Rehab Mask, you'll see, is a Mediterranean detoxifying mud mask. It is available for, it's in our detox facial treatment, which we'll talk about here in just a moment. But this is also available for your client to be using at home. So this is going to help to pull out and remove any sort of impurities. It's going to help to detoxify the skin, and making sure that any sort of impurities that are in there, any sort of toxins that are building up and creating any sort of inflammation or irritation. So the bentonite clay will seek out any of those impurities and just help to pull out and detoxify the skin. So that's going to be really the main thing. As that pore and that follicle, we're exfoliating it with either your alpha hydroxy acids, beta hydroxy acids, or the activated charcoal in the down and dirty. So now that pore is open, we want to be able to apply something that's going to go in there and really draw out that dirt, debris, and impurities. And the bentonite clay and the Mediterranean Dead Sea mud does a phenomenal job at being able to do that. Now, it also has, different nourishing oils and everything, so it's not going to over stress or over dry out the skin. This is a mask that your clients you'll want to apply a layer, allow it to sit on the skin for 10 to 15 minutes, and then you'll wash it off. This can be used twice a week, We slot this for nighttime use, but again, if you have a client that they have more time in the morning and they prefer to use this treatment in the morning, there's nothing in here that's causing any sort of photosensitivity that we would have to use it at nighttime only. Just make sure they're only using it once during that day, and you want to use it about twice a week. All right, next mask option is going to be our Live and Be Well. So our Live and Be Well is our probiotic mask. It works great in conjunction with the Get Balance probiotic serum, but it's also an option too that if they're not using the probiotic serum, it has the lactobacillus in there, and it also has the pink Himalayan sea salt. So the pink Himalayan sea salt is a natural detoxifier for the skin. And it also has a nice property. The Live and Be Well mask will help to create some microcirculation within the skin. So you're not going to get any sort of flushing or redness that can occur with stimulating any sort of circulation. So that's where it's the microcirculation, but it's getting that blood flow going. So anything that's like stale or stagnant within the skin, it's going to help to detoxify it by stimulating that circulation and getting the blood going. It also has powerful antioxidants in there that will help to improve and just strengthen the overall skin. This is a great option again for that maskne where your barrier function, your skin's not necessarily used to having your breath be so close to it and trapped in there for hours on end. And with wearing the mask, you're going to see a lot of different things that are occurring with the skin that might not be what you're used to, especially when it comes to treating acne. So the Live and Be Well mask will help to balance out the good and the bad bacteria while adding hydration and detoxifying the skin. So this one, you will apply a thin layer at night. Your skin will have this nice, radiant, hydrated glow to it after you rinse it off. You'll want to leave it on for 10 to 15 minutes and then remove it with water. This is also going to be used twice a week. You could use it morning or night. We have it slotted at night though. All right, so we've talked about a lot of different products, and it really, acne is one of those skin conditions that it takes patience and it takes time. So my biggest and best advice for you and for you to communicate and keep that open line of communication with your clients is to be patient. There's not one set daily care regimen that is going to necessarily work for every single acne client. So acne has its ebbs and its flows. There are some lifestyle factors that can contribute to it. So some things to, during your conversation with your clients, asking, some food triggers or sensitivities may cause it. Now, food won't necessarily cause acne itself, but if somebody suffers and has acne skin, acne prone skin, it can exacerbate the acne. So just talking them through some of those things. But if you're unsure of exactly where to start, especially with home care, our acne problematic skin repair kit is the perfect starting point. So here you will have the Cleanse as Needed cleanser. So again, this is going to be your 10% glycolic acid cleanser. Glycolic acid, remember, it's a small molecule, so it's able to penetrate into more of those kind of your open and closed comedones, more of your asphyxiated type acne. Use this once a day. So you don't want to use this cleanser morning and night, but it is appropriate once a day, especially for your acne clients. Then it also has your Fixit Pore Perfecting Solution. So this is going to be your 2% salicylic acid take home chemical exfoliation. Then you have your daily dose of water. So this is your hyaluronic acid. Holds up to 1,000 times its own weight in water and being able to form that hydration within the skin. And then last, it has the Rehab Detoxifying Mud Mask. So this is going to be your foundation. From here, you can, do we need a little bit more hydration, or are we wanting to add in more of that probiotic component to it? You can slot in your Get Balance Serum very easily within this treatment. The other thing is if they're still feeling dry, so the daily dose of water will add the hydration. If they're still feeling dry and daily dose of water is not enough, then that's perfect opportunity to add in that Call Me in the Morning. Remember, it's easier to add than it is to take away. So that if you have a drier acne, you can recommend and have them start with a Problem Skin Repair Kit and then have them also go home with the Call Me in the Morning. Now, there's one important take-home product and a product that they should be using on a daily basis that is not in this kit that I highly recommend, especially when you're exfoliating the skin anyway, is going to be a sunscreen. So your Ultra Skin Defense is going to be a must-have product that you want to be sure to pair with anybody who is going home or even being treated for any skin type or condition with you, is making sure that they're using a proper sunscreen at home. So the Ultra Skin Defense is a recommendation to make sure, especially if they're going home with this Problem Skin Repair Kit. Now, professional treatment wise, so our treatment protocol, we have the detox facial. A nice LED upgrade within the detox facial is going to be your blue LED. So blue light helps to seek and kill that bacteria within the follicle. So remember, that's one of the four main causes of acne, is an increase in that P. acnes bacteria. The blue light will help to target and kill off that bacteria. So within this facial protocol, you have your cleanse daily or cleanses needed option. So if you need a little bit more exfoliation, I would choose the cleanses needed over the cleanse daily. Then you have your exfoliation, so 10 minutes, utilizing your pre-squeeze to be able to treat and allow for easier extractions in there. And then you'll finish with a rehab mask. The rehab mask, again, that's our Mediterranean mud mask that's going to pull out all that dirt and impurities and detoxify the skin. You have the option for an LED upgrade. And then you have your finishing touch with your daily dose of water and Call Me in the Morning, or you have the option of Feel Better. When recommending treatments and frequency of treatment for your acne clients, you want to recommend that they come see you every 2 weeks. So for some sort of professional treatment. When you are dealing with some of those lower grades of acne, so your grades 1 and 2, the microdermabrasion treatment is another treatment option that you can recommend for these clients. So a good combo and treatment plan is to, one treatment they come in, do a microdermabrasion. Then 2 weeks later, do the detox facial. 2 weeks after that, we'll alternate and we'll go back into the microdermabrasion treatment. And then all the while they are using the proper home care to ensure that they are continuing that treatment plan at home and not just when they're coming to see you. Now, as those acne lesions start to decrease, the severity of them are decreasing within the time frame that you are treating them, you can gradually spread out those professional treatments to, start initially twice a month, every 2 weeks. Then you can move it out to every 3 weeks. normal maintenance part of a healthy skin regimen is having your clients come in once a month for a treatment. So once you and the client are happy with where their skin is at and the breakouts are under control, then still ensuring that they are coming to see you once a month for a facial treatment will be very important in ensuring that we're maintaining those results and keeping their skin in a nice clear state. I hope all of this information helped. If you guys have any questions at all, please do not hesitate to reach out to either myself or our education team, and we will make sure that you are getting all of your questions answered. So thank you very much for your time today. I hope you have a wonderful day.